Welcome to the office. Hi, Tonya.
Hi.
Welcome to the office.
Nice to meet you.
How can I help you?
So I have been experiencing like tremors. Almost it feels like weird vibrations in my head. It started in my head really, almost like electricity.
When?
That started 2 weeks ago. That was my first episode.
Okay.
And I ended up in the ER because with that, I was trying to relax into my body, do a meditation, and just go with the feeling.
Mm-hmm.
And I was like, this is so strange. And then my heart started racing, like really racing. So I got up and I was like, this is weird. And I'm walking around. And then my arms and my limbs went weak. And I was like, this is super strange. So to me, I was like, okay, these are all signs of a heart attack.
Mm-hmm.
And I called the ambulance. They came. They took me to the emergency room, did chest x-rays to check that there was no clots. And what else did they do? Blood work. Everything came back fine.
Okay.
And they were like, you just probably have anxiety. And I was like, I definitely have anxiety because something's going on in my body and I'm not sure what.
So before that episode 2 weeks ago, what was going on?
I went to Colombia and I had I went in August. I had a lot of dental work done. And then I went back to finish veneers and do the rest of like my crowns and everything. And I was awake for the whole procedure. So I know I was tensing up a lot and it was a lot of drilling. And as he was drilling, I was like, okay, I like feel weird in my head, you know? And he was like, it's fine, it's normal. But it was like really intense.
The vibration was bothering you from the drilling and the work. Okay.
Yeah.
All right.
And then I got
Prior
Botox.
to that, before that, you had no issues?
I had no issues.
In the neck?
Nothing. I mean, I have sciatica here in this one.
Right side.
Right side.
No neck issues before? You've had an old injury in the neck?
No, I always had a lot of, my stress and tension was always shoulders.
Okay.
But nothing neck. I never had any falls. I never had any accidents.
Okay.
Any work that I've ever had done, like that was really traumatic was dental.
No back injuries, anything?
No.
Right.
And then I had like an episode, like maybe.
So that's what you're here for, to figure out why
what's going on. And I'm having muscle spasms in my whole, like my legs. I can't sleep at night.
Okay.
And then I do feel stuck. And then I also had, I think my alignment was off. So I found a dentist here, and he tried to adjust my bite. I got Botox. Here and here to relax the muscle because I was very tense.
Okay.
But I also had Botox done in Colombia, so I'm like, does this have anything to that's why I wanted them to check my blood because I was like, did I get like an infection? Because it's just so weird that I'm having all these problems and it's like weird vibrations. I can't sleep, especially at night when I try to go to fall asleep. That's when my body just
on
starts.
Your back, on your side.
My side.
Right side, left side.
Both.
Both sides, doesn't matter.
Mm-hmm.
Okay. All right. What else?
The palpitations. I do get shortness of breath.
Okay.
But now I'm like ruminating. I mean,
it's
in my
all
head
kind of connected with what you're telling me, and I'm going to explain it when we go over your X-rays.
Yeah.
Okay?
And my lower back has been starting to bother me.
Okay.
So I'm like running on an hour of sleep because I try to fall asleep when my kids left. But I'm like, what is going on? Oh, and then I wake up with dry eyes. Like my eyes in the back have been like, I'm like, I've never had to do that before.
This all after dental work. Okay. Sounds like something upper cervically is going on. Yeah. Upper cervical pressure. I'll explain all of it when I go over your X-rays.
Headaches.
Okay.
And tension and a lot of head pressure too.
Okay.
And then like I feel like even though I meditate, I can't really relax. You know?
Even after Botox?
Yeah, even after Botox. This did help a little, but I think maybe something's still off.
And you had the dental work, when was it done again?
January 28th.
This year?
Yeah.
Okay, very recent.
Very recent.
Okay.
This all started like 2 weeks after.
Okay, all right. What else do I need to know about you?
That's it.
For now?
For now.
X-rays,
until I remember.
X-rays don't lie. We're gonna find out what's going on.
Okay, please.
Why don't we go over your X-rays?
Okay.
I'm gonna explain a lot of stuff.
Okay.
After I do that, I'm gonna examine you, figure out where we're gonna start.
Okay.
Kind of what you're telling me now. A muscle spasm is the body's protective mechanism. Something is going on, usually when that's around the spine area, okay? Or there's a joint that's not stable, it's a splinting mechanism. But all this stuff you're talking about kind of relates to the upper cervical. And it makes a little bit of sense with having extensive dental work. Your mouth was open a long time, you're in different positions with the mouth, and they're drilling away, and let's see if something.
And now I'm
like
my anxiety is all the way up. I'm like, I can't relax, and like I feel like my vagus nerve bowel. I can't eat nothing, and then when I do eat, I'm right in the bathroom.
Right away?
Not like maybe like
20
10,
minutes?
15, yeah.
Within 20 minutes?
Yeah. I'm having to go.
All right.
So now I have to go back and do more blood work because they're like, what's going on?
What if this is all vagus nerve?
I think it is.
That's why you're here?
I'm sure it is.
That's why you're here?
Yeah.
And you came from, how'd you find me?
I found you on TikTok.
I appreciate it. Thank you, TikTok.
And I knew that this had to be, because I can't feel like this every day.
Okay. Which
Something's
video got
going
you?
on.
I'm just curious.
Was a whole
I'm just
bunch.
curious which one got you.
And since I can't sleep at night, I keep going to your page and looking.
Okay.
I'm like, this has to be an upper cervical issue, the atlas, and I'm like really trying to look into this.
Now, you've watched me explain some x-rays?
Yes.
Okay, so it could be upper cervical, yes, we're thinking. However, we need a level base and foundation for all this stuff to hold, right? So if we got a problem in the foundation down in the basement and up in the penthouse, we got to sort that out too. Okay? You ready to get started?
All right, yes.
Come on over. Now, a couple of things we can see right off the bat, right? You're going up and then you're kind of just tilting to that left side. You see that, right? Okay. Now, 24-story building, in order to have a stable building, we need a level base and foundation. So the first thing is, do we have a level base and foundation? And the answer is no, we do not. So what's the issue here? We have a little bit of rotation of the sacrum. 1 millimeter, I'm not so excited about that. However, it is dropped down 4 millimeters on this left side, and we have a 4 millimeter measured difference of the hips. Left side is lower, probably came from that, probably. There is also a pelvic misalignment, AS3-EX1. If I adjust your pelvis, 4 becomes 5. So this probably happened after your tailbone injury, okay? There was some tailbone injury, I'll show you on the other x-ray, and then whatever happened in the pelvis came after. Now, the interesting part, you have a lowered leg, 4 millimeters, even if it's 5, it's still under 7 millimeters. Adjustments will hold. We don't need to put a lift or any intervention in there, okay? The other interesting part is that your spine goes away from the lowered leg. Typically, if it's posture only from lifestyle posture habits, then it should curve to that lowered side. Yours goes away from it. So you've had a few things going on, okay? You don't have to. So that's what I see. Number one is the sacrum dropped on that side, and then we have the pelvis. Now, let's go to the side profile, and I'll be going back and forth, okay? Okay, on this x-ray, what are we looking at? We're looking at posture, curvature, and discs. And by the way, there is good news I'll go over at the end. That's at the end.
Okay.
So I said, you flossing, right, in the car? So everyone thinks, no, I have videos called Flossing for Your Spine, which are basic extension exercises. And I call it flossing because you should do it every day, just like flossing your teeth. Then I have flossing for your shoulders, but that's not what I'm talking about, guys. I'm talking about she'd be rolling like this. I'd be
rolling dirty.
Yeah, she was rolling dirty back in the day. So I want you to see how that's affected your posture, though. Check it out. Look, this is your posture line. This line should be going through the neck here. So what it's showing us is your upper body is completely behind your foundation. And so these muscles and ligaments in the mid and upper back have to work overtime. So you get all this tension going across here when you're sitting for long periods of time or standing long periods of time. So part of this is we got to figure out how we're going to get that forward for you. So there's some habit changes you're going to need to do, okay?
Okay.
All right, so that's the posture. Curvature. When we're looking at curve, we should have a 40 to 60 degree curve in the neck. Yours is going the opposite way. We should have a 60 degree curve in the mid-back. Yours is kind of flat. Now, it looks like you have a good curve in the low back. You curve to right about there, and then you sway back. You see that? So we got to bring this whole thing forward. Okay, but not just adjustment, habit. Now let's get into the tailbone and see where this all started. And so when we're looking at the tailbone, 1, 2, 3, 4, yeah.
I had something here in this leg since I was little. It always bent inwards. So all my shoes always go inwards. And so I always knew something was off here, which this is the leg that I have the sciatica in.
Interesting. Okay. We'll take a look at it. Okay. Now, when you're saying that, the question is, there was probably an injury. That's what I'm trying to get to. Is there an injury? And if we look at your tailbone, I want you to see something. There's something interesting here. Let's zoom in here first. L1, 2, 3, L4. You see L5 is kind of just trying to be part of this sacrum now. All right? But if we look at the tailbone from this end, this is what's interesting. This should be a smooth arc. And I do see S5 coccyx. You had some tailbone injury at some point, whatever it was. So we have S5 coccyx. We have the sacrum that we need to bring that whole thing up. Now I just want to see this a little bit closer because something's off. All right. Yeah, okay. So this is your 5, okay? And if we look here, these are the transverse processes where the muscles attach. This one kind of spatulates a little bit here and here, and it's trying to, you're stuck on that right side. It's trying to, you have a lot of scar tissue on that right, so it's getting stuck on this right side. So I'm pretty sure we're going to find pressure here, but we wouldn't start there. We have to start down here on the left because we have to bring that side up. If we don't have a level foundation, your basement's not right, we don't want to be working on the first floor. Does that make sense?
Right,
We've got to get the basement right first. So let's go back. Okay, so we have S5 coccyx. From there, let's work our way up. Now, overall, the discs are good, okay? This is tilting back. We'll need to deal with that 5 after the tailbone. 5 tilts, 4, 3, 2, 1. 12 levels off. So your whole lumbar spine, all of this is compensating for your tailbone. Okay? Now, discs are good. Discs are good. Discs are all good. I can see to there. That one I can't see there. I'll look on the other. Now, whatever happened here, 2, 3, 4, 5, 6, 7, started at C7, caused it to go back. 6 goes with it, and then the body starts to compensate. Now, why is your body compensating? 2 reasons. There was a whiplash, yes, in the neck. But because the upper body is so far behind, the body is trying to also compensate. Otherwise, if your head was in the normal curve, you'd be looking up all the time.
Yeah.
Does that make sense? So the take-home message on this X-ray, we have tailbone injury. We've got to figure out how to bring this forward. And then 7 is going to be part of the fix of the neck.
Is that the upper cervical?
I'm not there yet.
Oh, you're not even there
I'm
yet.
not there
Sorry.
yet.
Apologies.
We got to get there. We got to deal with this. But let's go up higher now. Let's go see what we see in the upper cervical. Because here's the thing. You have the reverse curve. If there's pressure in C1, I'll deal with it. But it's not going to hold without correcting the rest of the stuff. It's just not. So I have a feeling, a strong suspicion, this stuff was already going on. Whatever happened during the dental work was a trigger of a process that was already happening. Make sense? Okay. So let's look at your spine from here. We can see it goes this way. And then there's kind of that hard turn to the left side. But the body stays to that side. The good news in that scenario is none of these bones have changed shape, so you still can change a lot of this habit and posture, okay? But I think you're here because you're ready now.
Yeah.
You're ready now. Okay, now let's get to the upper cervical and see what we find. On this X-ray, we're looking at the upper cervical. We have a swollen C1 on the left, yes, compared to the right. All of this is rotating. Big, small, 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 small, big. So your upper cervical starting here. This one. 12, 11, 10, T9 is where it's all starting, which is your fight or flight. It's T9. T9,
That's why I've been crying so much too. It's all emotion. It's horrible.
It's all turning, starting at T9. You ready to let it go?
Yeah.
All right. If there's pressure there, I'll deal with it today. But if there's no pressure there, we need to focus on foundation in T9.
Okay.
Which is fight or flight.
Yep.
Now, do we need to end in relaxing or more energy? We need more energy or we need to relax?
Relax.
Okay. You ready to get started?
Mm-hmm.
Let's do it. Starting at the base of the neck, head down, please. Let's see what we got. And the first thing we're getting is 20 points, left side. C7. Oh, 25 points, C1. What? I didn't expect that one. C7, C1 left side. T6, T7. Make that T9 left side, 10 points. Oh, we need to have. You're holding a lot of that trauma in your body, lady.
Mm-hmm.
You know that.
Yep.
S5 coccyx down low. S5 coccyx, T9, C7, C1. Those are the majors that I'm getting today. Let's go ahead and run the meter down the back. Static palpation. Head down, please. Mm-hmm. More tender there or there?
First one.
That's 9.
Yep.
T9. Let's check the hips. Scoot forward a little bit. Feet touching. Open and close your knees with your feet touching. Open and close. Open and close. Right side only. Do the right side only. Left side only. Keep going. Right side. They're both kind of stuck. Scoot back for me, please. Now let's check down low. Come back slowly towards me. This is 5. Tender. 1. More tender.
Yeah.
2. Tender. 3. More tender. 4. Tender. 5. That's where I'm getting it. You feel that more on the right or the center? You're holding your breaths. Breathe. Breathe. Deep breath. That one. That one. S5. T9, S5. Sit back for me, please. Scoot back. You ain't flossing here, girl. Come on. Ain't no flossing. Flossing for the spine, flossing for the shoulder. 7, 7, 6, 5, 4, 3, 2, and 1 on the left. Stand up for me. Let's check the walk. Walk to the corner of the room and back a couple of times, please. So what's the goal when you feel better?
To feel better.
What's the goal when you feel better? Then what are you going to do?
I'm going to start running again.
And then what? You're working right now?
No, I go to school. I'm doing my, I'm in grad school.
For?
Psychology.
Okay.
Yeah.
Keep going.
Keep going. Okay.
All right. You have a seat over here. And let's formulate the game plan for today. We're going to start on S5, the tailbone, okay?
Okay.
Then we're going to do T9, have you walk. Then we're going to see if 7 and 1, I'm pretty sure 1 is going to go away.
Okay.
One of them is not going to be there. I don't know which one yet.
Okay.
Okay?
Yep.
All right. You ready?
I'm ready.
Let's do it. So we want to bring the right side up. Let's go. We want to bring the left side up, so let's go right side down. Lay on your right side, please. Bottom leg straight. Bend the top. I got you the whole way, okay? Come forward. Cool. Bring this back, hand back, back, back. I'm going to be on the outside right now, okay? Relax it forward, let it roll. I got to push that up, okay? I got to bring that, let it roll, let it roll. That's a piece. Come up slowly, we got to do it there. Okay. We're going to lift S5. Good. Gotcha. Feet together. Let's bring this down. Now T9. You doing okay there? Mm-hmm. T9. Relax the shoulders. Good. That's the home run. Gotcha. Awesome. I'm going to bring you up now. You survived. Step back, please. Step away from the vehicle. Come over here. And let's walk it out. Check it out. Walk 2 times back and forth.
Like I'm going faster.
Yep. Deep breath in. Blow it out. Have a seat over here. You remember what it felt like in the bottom?
Yeah.
Okay. Check it out. Come back slowly. Watch. S1. S2. S3. Different?
Yeah.
S4. I didn't touch these. This is the one I did. Different?
Yeah.
Yeah. I'm messing with you.
Wow.
Okay, now let's scope up top. Sit back here. Center on the chair for me, and let's figure out what's going on up top there. Seven is clear. 1 is 25 points still. Now you're going to get your vagus nerve, okay?
Okay.
All right. Bismillah. Center. Scoot to the left a little bit. Okay. Bring that chin back. Good. C1 ASL. Left ear down. Left ear down. That's the home run. Gotcha. Hi. You survived.
I did.
Walk it out. Check it out. One more time, please. Pretty cool. Have a seat. Let's rescope. But I do hear Colombia is beautiful.
It's gorgeous.
And the people are really cool and
did
friendly.
Yes, I got a chance to go out and like do some stuff, so it was really pretty.
Claro. Nick is clear. Claro. Clarísimo. Claro. Where are you originally from?
South Africa.
Well, South Africa?
Yes,
Right
sir.
on. Right on. T9. Clear. Tailbone. Clear. That's where we're going to start. May I continue?
Yes, sir.
Shoulders. Let me do the work. shoulders. Let me do the work. There you go. On your back, please.
You are a wizard.
Are you like not nervous
you're a
anymore?
Wizard.
Are you not nervous anymore? You're over it now?
I am.
All right, cool. Anticipation. Raise the left leg. Left leg up. You're going to let go at one of the visits. When you're ready, you do it, okay? You're not ready yet. Big toe. Little toe. Okay, that's bonus. All right. Let's check the jaw. Look up. Slowly open the mouth. Open, open, open. Left side. Open. To the left. Shall I do a little bit on this left side? Okay. Open all the way. Open. Close half. Hold. Open. Open all the way. Close slowly. Good. I got you. Booyah. Nice. Open. Voila.
Wow.
That's where we're going to start, okay? I'm going to do a buff and polish on the back,
Okay.
and then you're going to have some homework.
Okay.
Sit straight, please. It's a buff and polish, okay?
Okay.
Oh, you saw some of those Botox TMJ cases I had, huh? Yeah, that's what it was.
All the nights I couldn't sleep, I watched your videos. And I was like, I can't wait to get out. You were in Dubai. I was like, can you hurry up?
I'm not traveling this month, by the way, okay?
Okay,
March,
good.
I'm here. So I'm here till 3rd week of April.
Okay, because I'll have you the next 2 weeks coming.
Yeah, we have a couple of visits to do. Stand up for me. Let's check the hands. Squeeze. Right over here. Easy, tiger. Put it down. Squeeze. Let go. Squeeze. Let go. Elbow. Squeeze. Those are mom hands. Those are definitely mom hands. The mom hands. You know what that means, guys? Mom has to take care of business. There you go. Squeeze. Squeeze. Turn and face the Kina. Wow. All right.
I feel like I can see again.
What's that?
I feel like I can see again. But before, when I came in here, I was like so nervous. And like I just feel like.
Take a deep breath. Check it out. Again. Again. Cool?
Cool.
Welcome to the office.
Thank you.
You're welcome.
You're amazing.
Thank you.